What are antihistamines? I'm Dr. Manan Shah. I'm an ENT allergist with Wyndly Health. In terms of allergies, when your body's exposed to an allergy trigger, it releases a molecule called histamine. Histamine causes the symptoms of allergies like runny nose and watery eyes. So antihistamines block the release of histamine and fix your allergy symptoms, at least for the time that you're using them. The most commonly known antihistamine is Benadryl, but in general, we recommend people use second generation antihistamines like Claritin, Zyrtec, or Allegra, since these medications are less sedating. If you'd like to learn more, please subscribe. What do antihistamines do? I'm Dr. Manan Shah with Wyndly Health. I'm an ENT and an allergist. When your body is exposed to one of your allergy triggers, you release a molecule called histamine. Histamine is a vasodilator, meaning it makes your blood vessels get bigger. This leads to more blood flow to the area, and it helps your body create more mucus to wash the allergy trigger out. It helps your eyes tear to also wash the allergy trigger out, and it helps you sneeze or itch to try to rub or blow the allergy trigger out. An antihistamine is a medication that blocks histamine from being released. This improves your allergy symptoms for the duration of the time that the antihistamine is in your body. It's not a long-term solution, but they're a great allergy medication for short-term relief. If you'd like to learn more, please subscribe. What is the best over-the-counter antihistamine? I'm Dr. Manan Shah. I'm an ENT and allergist with Wyndly Health. The best antihistamine depends on what you need. So the fastest acting antihistamine is cetirizine, otherwise known as Zyrtec. That's going to get in your body within 15 to 20 minutes and start working, but it can make you somewhat drowsy. So the least sedating antihistamine is fexofenadine, otherwise known as Allegra, and that one is going to keep you from feeling drowsy and foggy. So it really depends on what you want. I tell my patients to try Claritin, Allegra, and Zyrtec and figure out which one works best for your body. Thanks. Is it safe to use antihistamines every day? In general, most of the available over-the-counter antihistamines are safe for long-term use. There are some potential side effects, and there are some cases where long-term antihistamine use can worsen urinary retention or narrow-angle glaucoma. But I think one of the biggest risks is that patients start using these antihistamines every day and sometimes forget they're on them, and they can then interact with other medications that your physician could prescribe you. So it's really important to work with your physician when you're using any medication for a prolonged period of time. I think it's also important to know that there are therapies called immunotherapy, which can actually desensitize you to your allergy triggers. So hopefully you don't have to use as many antihistamines. If you'd like to learn more, we'd love to work with you. Thanks. Why do antihistamines stop working? There's a couple of reasons that you might not think about for why your antihistamines just stop working. The first reason you might not think about is that your allergies just might be getting worse, or you might be getting new allergies. The second reason you might not think about is that due to climate change and warming, we seem to be seeing that pollen season is lasting longer and longer each year, so people are experiencing worse allergies. And the third reason that you really might not think about is that as you get older, your immune system changes and many patients start to experience worse and worse allergy reactions. The good news is if you work with a physician, you can often find a medication that will help your symptoms, and that way you can get relief. Why do allergy medications not work? A lot of my patients tell me that allergy medications stop working for them, or that they have to keep switching meds, or that they're immune to certain allergy meds. That's pretty complicated, but ultimately what I think is happening is different medications work differently for different patients, and sometimes your allergies are just getting worse and you need to switch it up. The good news is we have a lot of different tools in our toolbox as allergists, so we can try over-the-counter antihistamines, we can do nasal sprays, and we can do something called immunotherapy, which is where we give you small exposures to your allergy triggers, and over time your body gets desensitized. Ultimately, if you feel like your allergy medications aren't working, you may want to work with an allergist because we can probably get you feeling better.